Hi, today I'm going to talk about the relationship between exercise and rheumatoid arthritis, also known as RA. The specific article that I'm going to talk about was published in 2012 by Carmen Pastragos, Katrina Nkota, Smiranda Mill, E. Nkota, and Rod Katrek in the Romanian Journal of Rheumatology about the immune response of aerobic exercise to RA patients. Uh, the benefits of exercising to persons that don't have RA are already well known by pretty much everyone, but the relationship between exercises and RA patients is not very well studied, so they decided to do this research with the objective to examine the effects of non-drug treatments such as exercise as an adjunct to medications for patients with RA active. So in their study, they collected 40 subjects who had attended to the same hospital in Romania between 2010 and 2011. Another criteria that they used to choose the subjects were that they had to be at least 3 months with unchanged anti-rheumatic drugs and at least 1 month of unchanged non-steroidal anti-inflammatory drugs. Patients that had other disease than RA, which made exercise impossible or contraindicate, and patients that had at least 1 month of training were not chosen for the study. They look at three factors in the subjects. They were looking at disease activity levels. They were also looking in blood exams for finding levels of inflammations in the body of the patients, and they also look in functional mobility in the patients. So for this study, they divided the 40 subjects in two subgroups, 20 subjects in each subgroup. In one of the subgroups, they told them to not exercise at all, and for the second subgroup, they told them to do 30 minutes of walk per day, 5 days a week. They collected the data in three different times: at the baseline, before they started the study, 3 months after, and 6 months after. At the baseline, it is important to notice that they did not find any significant difference between the data collected from the exercising group and the non-exercising group. After 3 months of research, they found that the exercising group had decreased level of disease activity compared with baseline, and also decreased level of inflammation that was noticed by the blood exams. But they did not find any difference on the functional mobility in the patients. And on the non-exercising groups, they did not have any difference between the baseline and after 3 months. After 6 months, they noticed that the exercising group had even better improvements in the disease active levels and also in the inflammation, but they still had not find any difference in functional mobility. And for the non-exercising group, they still had the same results as the baseline. They did not have any significant change. So by that study, it was possible to notice that exercise, aerobic exercise specifically, has positive effect in patients with active RA. By that study, it was also possible to find three future possible areas of research. The first area of research would be doing the same research again, but this time with more subjects, because 40 subjects is not enough. So if they did the same study with more subjects, a larger group, they would have more significant results. And another area of results would try to find a relationship between exercise and mobility, functional mobility in the RA patients. And another area, the third one, would be trying to find a relationship between other types of exercise other than aerobic in patients with RA. Thanks for listening to me. If you have any questions, please feel free to ask me. Thank you.